Question 11. An antihypertensive medication has been prescribed for a client with hypertension. The client tells the clinic nurse that he would like to take an herbal substance to help lower his blood pressure. The nurse should take which action? A. Advise the client to read the labels of herbal therapies closely. B. Tell the client that herbal substances are not safe and should never be used. C. Encourage the client to discuss the use of an herbal substance with the healthcare provider, HCP. D. Tell the client that if he takes the herbal substance he will need to have his blood pressure checked frequently. The correct answer, C. Although herbal substances may have some beneficial effects, not all herbs are safe to use. Clients who are being treated with conventional medication therapy should be encouraged to avoid herbal substances because the combination may lead to an excessive reaction or to unknown interaction effects. The nurse should advise the client to discuss the use of the herbal substance with the HCP. Therefore, options A, B, and D are inappropriate nursing actions. Question 12. The nurse educator asks a student to list the 5 main categories of complementary and alternative medicine, CAM, developed by the National Center for Complementary and Alternative Medicine. Which statement, if made by the nursing student, indicates a need for further teaching regarding CAM categories? A. CAM includes biologically based practices. B. Whole medical systems are a component of CAM. C. Mind-body medicine is part of the CAM approach. D. Magnetic therapy and massage therapy are a focus of CAM. The correct answer, D. The 5 main categories of CAM include whole medical systems, mind-body medicine, biologically based practices, manipulative and body-based practices, and energy medicine. Magnetic therapy and massage therapy are therapies within specific categories of CAM. Question 13. The nurse hears a client calling out for help, hurries down the hallway to the client's room, and finds the client lying on the floor. The nurse performs an assessment, assists the client back to bed, notifies the healthcare provider of the incident, and completes an incident report. Which statement should the nurse document on the incident report? A. The client fell out of bed. B. The client climbed over the side rails. C. The client was found lying on the floor. D. The client became restless and tried to get out of bed. The correct answer, C. The incident report should contain a factual description of the incident, any injuries experienced by those involved, and the outcome of the situation. The correct option is the only one that describes the facts as observed by the nurse. Options A, B, and D are interpretations of the situation and are not factual information as observed by the nurse. Question 14. A client is brought to the emergency department by Emergency Medical Services, EMS, after being hit by a car. The name of the client is unknown, and the client has sustained a severe head injury and multiple fractures and is unconscious. An emergency craniotomy is required. Regarding informed consent for the surgical procedure, which is the best action? A. Obtain a court order for the surgical procedure. B. Ask the EMS team to sign the informed consent. C. Transport the victim to the operating room for surgery. D. Call the police to identify the client and locate the family. The correct answer, C. In general, there are 2 situations in which informed consent of an adult client is not needed. One is when an emergency is present and delaying treatment for the purpose of obtaining informed consent would result in injury or death to the client. The second is when the client waives the right to give informed consent. Option A will delay emergency treatment, and option B is inappropriate. Although option D may be pursued, it is not the best action because it delays necessary emergency treatment. Question 15. The nurse has just assisted a client back to bed after a fall. The nurse and healthcare provider have assessed the client and have determined that the client is not injured. After completing the incident report, the nurse should implement which action next? A. Reassess the client. B. Conduct a staff meeting to describe the fall. C. Document in the nurse's notes that an incident report was completed. D. Contact the nursing supervisor to update information regarding the fall. The correct answer, A. After a client's fall, the nurse must frequently reassess the client because potential complications do not always appear immediately after the fall. The client's fall should be treated as private information and shared on a need-to-know basis. Communication regarding the event should involve only the individuals participating in the client's care. An incident report is a problem-solving document, however, its completion is not documented in the nurse's notes. If the nursing supervisor has been made aware of the incident, the supervisor will contact the nurse if status update is necessary. Question 16. The nurse arrives at work and is told to report, float, to the intensive care unit, ICU, for the day because the ICU is understaffed and needs additional nurses to care for the clients. The nurse has never worked in the ICU. The nurse should take which best action? A. Refuse to float to the ICU based on lack of unit orientation. B. Clarify with the team leader to make a safe ICU client assignment. C. Ask the nursing supervisor to review the hospital policy on floating. D. Submit a written protest to nursing administration, and then call the hospital lawyer. The correct answer, B. Floating is an acceptable practice used by hospitals to solve understaffing problems. Legally, the nurse cannot refuse to float unless a union contract guarantees that nurses can work only in a specified area or the nurse can prove the lack of knowledge for the performance of assigned tasks. When encountering this situation, the nurse should set priorities and identify potential areas of harm to the client. That is why clarifying the client assignment with the team leader to ensure that it is a safe one is the best option. The nursing supervisor is called if the nurse is expected to perform tasks that he or she cannot safely perform. Submitting a written protest and calling the hospital lawyer is a premature action. Question 17. The nurse who works on the night shift enters the medication room and finds a coworker with a tourniquet wrapped around the upper arm. The coworker is about to insert a needle, attached to a syringe containing a clear liquid, into the antecubital area. Which is the most appropriate action by the nurse? A. Call security. B. Call the police. C. Call the nursing supervisor. D. Lock the coworker in the medication room until help is obtained. The correct answer, C. Nurse Practice Acts require reporting impaired nurses. The Board of Nursing has jurisdiction over the practice of nursing and may develop plans for treatment and supervision of the impaired nurse. This incident needs to be reported to the nursing supervisor, who will then report to the Board of Nursing and other authorities, such as the police, as required. The nurse may call security if a disturbance occurs, but no information in the question supports this need, and so this is not the appropriate action. Option D is an inappropriate and unsafe action. Question 18. A hospitalized client tells the nurse that an instructional directive is being prepared and that the lawyer will be bringing the document to the hospital today for witness signatures. The client asks the nurse for assistance in obtaining a witness to the will. Which is the most appropriate response to the client? A. I will sign as a witness to your signature. B. You will need to find a witness on your own. C. Whoever is available at the time will sign as a witness for you. D. I will call the nursing supervisor to seek assistance regarding your request. The correct answer, D. Instructional directives, living wills, are required to be in writing and signed by the client. The client's signature must be witnessed by specified individuals or notarized. Laws and guidelines regarding instructional directives vary from state to state, and it is the responsibility of the nurse to know the laws. Many states prohibit any employee, including the nurse of a facility where the client is receiving care, from being a witness. Option B is non-therapeutic and not a helpful response. The nurse should seek the assistance of the nursing supervisor. Question 19. The nurse has made an error in a narrative documentation of an assessment finding on a client and obtains the client's record to correct the error. The nurse should take which actions to correct the error? Select all that apply. A. Document a late entry in the client's record. B. Draw one line through the error, initialing and dating it. C. Try to erase the error for space to write in the correct data. D. Use whiteout to delete the error to write in the correct data. E. Write a concise statement to explain why the correction was needed. F. Document the correct information and end with the nurse's signature and title. The correct answer, B, and F. If the nurse makes an error in narrative documentation in the client's record, the nurse should follow agency policies to correct the error. This includes drawing one line through the error, initialing and dating the line, and then documenting the correct information. A late entry is used to document additional information not remembered at the initial time of documentation, not to make a correction of an error. Documenting the correct information with the nurse's signature and title is correct. Erasing data from the client's record and the use of whiteout are prohibited. There is no need to write a statement to explain why the correction was necessary. Question 20. Which identifies accurate nursing documentation notations? Select all that apply. A. The client slept through the night. B. Abdominal wound dressing is dry and intact without drainage. C. The client seemed angry when awakened for vital sign measurement. D. The client appears to become anxious when it is time for respiratory treatments. E. The client's left lower medial leg wound is 3 cm in length without redness, drainage, or edema. The correct answer, A, B, and E. Factual documentation contains descriptive, objective information about what the nurse sees, hears, feels, or smells. The use of inferences without supporting factual data is not acceptable because it can be misunderstood. The use of vague terms, such as seemed or appears, is not acceptable because these words suggest that the nurse is stating an opinion.